ECT is a medical procedure that utilizes a small electrical current that's applied to the brain to, in essence, induce a seizure. It's a controlled seizure, and through that process, we find that mood improves. It is FDA approved for the treatment of unipolar and bipolar depression, so depression usually with or without psychotic features, but can also be used to treat mania in certain situations. A lot of our patients actually come to us much further down that track where they've been on, it's very common for patients to say, I've been on every medicine and nothing works. And every medicine, maybe 30 different medicines, and nothing has worked. We don't want it to get to that space because that's years worth of suffering when in fact ECT can be used earlier on in that process. ECT, oftentimes during the treatment, you don't feel anything because you're asleep. That's one of the big things, and one of the things we make sure of is that you are asleep before we do anything. Afterwards, most of the time patients will kind of have sometimes body aches, sometimes headaches. Those usually get better with Tylenol or sometimes just on their own. Most of our patients don't immediately feel better, so after the first treatment you're not going to spontaneously have a change in mood. However, over a period of treatment, they'll start to notice that small things tend to change. It tends to be, I'm sleeping better, or I'm wanting to be around my loved ones a little bit more and I'm more social, or I'm eating better. Or, I went for a walk for the first time in 6 months and it felt good. Those are the small things that we tend to see when ECT is starting to work. So a series of ECT treatments tends to be anywhere from about 8 to 14 treatments. We perform ECT usually 3 times a week, so it's usually a Monday, Wednesday, Friday schedule. So ECT can be used in multiple different age ranges. Most of our patients tend to be anywhere from mid-30s to like 70s, and in that range. So anything from the general adult population all the way to geriatric populations. It is also used in mainly adolescents, not as much as in kids, but can be depending on the illness. There are nurses that are usually in the room with us, as well as someone like myself who's one of the psychiatrists who will be performing the treatment. There's also an anesthesiologist that works with us, and that person is specifically responsible for making sure that the medications are given correctly and that the patient is safe while we're doing this treatment. It's a very short procedure. It takes less than 5 minutes usually from start to finish, from the time that someone is given medication to go to sleep to the time that they wake up. It is very safe. It is a very well-studied treatment. It's been around for a long time. It has definitely changed over the years. Common side effects tend to be things like headaches, sometimes some body aches. There is also, of course, the main thing that oftentimes patients will notice is some difficulty with kind of short-term memory in and around the treatments. What we find is that actually memory over the space of a week to a month after the series is completed, memory actually gets better than what it was before we started, because now the individual is no longer dealing with depression, which negatively affects memory. When it comes to ECT, the biggest thing is I don't want the patient or the family to worry alone. I don't want the attendings who are referring our patients to worry alone. So if they have questions, I would much rather them ask questions, however small they think it is or silly they think it is. Ask the question, because I want to make sure that they are comfortable with what we're doing, because I know this treatment works, which is why I do it.